On the Health Watch this morning, Connecticut is facing a shortage of primary care doctors. Question is, how is this impacting all of you across the state, and what can be done about it? Well, joining me now is Teladoc Health's Chief Medical Officer, Dr. Vidya Raman-Tangella, to talk more about this. Doctor, thank you for joining us. Good morning. How are you today?
I'm doing great. Thank you for having me.
Yeah, glad to have you here. First things first, let's talk about the problem before we talk about solutions. What, in your opinion, is the reason behind this shortage?
Well, there are many, right? So we're seeing this across the country, shortage of just healthcare providers and specifically primary care providers, many reasons, everything from geographic remoteness to just workforce shortages, to increase in population or certain densities of population in certain areas that cause the mismatch between demand and supply, lower accessibility, lower availability of appointments, and so on and so forth. Numerous factors, I think, that are playing into the primary care shortage. But, you know, I should also highlight that post-pandemic, I think we're also seeing an increase in health risk and disease go up. Yep. So fortunately, the demand's going up.
Yes, and that's really where telehealth and telemedicine has come in. It's sort of, we were talking before, maybe the pandemic accelerated a trend that was already there, at least from what I'm hearing, talking to people I know in the healthcare industry. How is that going to sort of change the game in terms of access to people, in terms of access to preventative care as well?
No, excellent questions. You're right. It was the pandemic, I think, was a huge catalyst. If nothing, I think it opened our eyes to the possibilities of virtual care, both from a provider standpoint, the patient standpoint, as well as across the healthcare ecosystem. So the way it solves for the problem is it removes the difficulty around access and availability. So for instance, at Teladoc Health, we are able to schedule patients in for their first primary care visit within a week, typically within 5 days.
Right.
And a visit lasts almost an hour, about 15 minutes, and there's a primary care physician, there's a care team that puts together a comprehensive care plan to take care of this patient. Included in the care plan is the focus on preventive care that you talked about. That is one of the most important fundamental roles of primary care, isn't it? To kind of focus on prevention, catch things early, and then if something's got, determine what to do about it next. So all of those are essential aspects and facets of primary care that we provide, and we follow the U.S. Preventive Task Force guidelines in doing so.
Which is good. And yeah, not just access, but also convenience for people who otherwise
100%.
would go to a doctor. But on the flip side of it, I think you could also understand why people might be a little worried that they don't get the level of care doing things remotely that they would. So what would you say are maybe some of the limitations and how those can be overcome, or how this can complement traditional doctor visits?
Again, great question. No, I can totally relate to that, right? That perception of, oh, this is perhaps not the same. But what I would say is that in a lot of ways, this can actually be better. So again, if I think about our organization and what we do, you know, every time a primary care physician is able to find, or for instance, we're finding that 65% of patients that we see through in our primary care program have never had a PCP before, but they've come to us. And many of them tell us that they wouldn't have otherwise sought out a PCP. And we are detecting diseases like hypertension and diabetes for the first time in about 25 to 35% of the population. So what are we doing here? We're actually preventing, we're catching things early, putting people on the right course. And more importantly, we have resources under our own umbrella to take care of chronic conditions. And so what I would say to people is that try virtual care, because it can actually provide that continuity and the longitudinal nature of care that is typically necessary, and it helps tremendously. We are finding a lot of people who have missed their screenings, right? Mammographies, smears, colonoscopies, and we're able to steer them in the right direction. So so we're very gratified in how we are seeing the value virtual primary care play out.
Yeah, a lot of those screenings, missed screenings, have gone up since the pandemic too, and it's a good point you make. Any care is better than no care. A lot of these
100%.
people were getting none. Dr. Raman-Tangella, thank you so much for taking the time to join us today and to let people know the benefits of telehealth and telemedicine.
My
we do
pleasure.
appreciate it. Thank you.